So when somebody has abdominal tension, typically one of those problems will be psoas or diaphragm problems, right? So the psoas rubs up either side of the spine and then pierces the diaphragm. So what we want to do is we want to use a ball. Now we have two types. We have a gel-filled ball and a more hard, solid 5-inch ball. Either side, and I'll demonstrate with the blue ball. Now you don't want to be on the ribs. You want to be underneath the ribs in the center and go just off the center for the psoas, all the way down through the hip, right? So that's what it'll look like. Now, what the position will be on your stomach. And I don't want people to roll to the position. I want them to find the position and then relax on top of the ball. Then lift up, move the ball, and relax back down on it. Now there's a little bit of roll side to side. And you want to find the most painful spot in there. Now make sure that it's not going bump, 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 because that's your aorta, and you don't want to compress the aorta. Typically the aorta should move out of the way, but it doesn't always, so be aware of that. So again, all the way down through the hip, and we oftentimes teach people to get the anterior hip here, but this is a little bit different because we're actually in the abdominal cavity, right? We're on either side of the abdomen there. So you can go a little further out, a little more towards the center. Now some people, we want their pelvic organs, and that's going to be in the middle, right above their pubic symphysis. And again, they'll lay down and put pressure there with a slight roll to the side and movement around. But if it's too painful, I want you to lift up, move the ball, and lay back down. Okay, so for pelvic organs, we're going to stay between the ASISs, which is the pointy parts of the hip. We do this. So I want the pubic symphysis will be there, and I want you to lay here for pelvic organs, up and down either side of the spine for the abdominal organs, or for the psoas, because the psoas will be right between, or right next to the spine on either side. Now, obviously, if you're doing one of those, you're doing all of those to some degree, but moving towards the center and moving around, again, be cognizant of anything going bump, 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 bump. Don't compress those, but you'll be doing abdominal viscera or abdominal organs, and or pelvic organs, and or the psoas. Or across the top, you'll be doing the diaphragm as well. Okay, so and the colon attaches to the diaphragm either side here. So of course, right above the psoas, a little bit to the side, that's where we would want you to use the ball. And again, use whichever ball is most comfortable and least harmful at feeling at the time.